And we are back with Dr. Ashish Arora. He's talking about strokes and what you need to know and how to handle them. So let's go over what are the signs that we should all know that may indicate that someone is having a stroke.
So the quick mnemonic to remember for strokes is be fast. B as in balance. If you suddenly become imbalanced, dizzy, or you cannot walk in a straight line. E is for eyes. If you see someone or yourself, you feel that you can't see towards one side of your visual field, or your eyes are gazing to one side without being able to come to the middle, that's for eyes. F is for face. It's for face drooping or facial weakness. You might see the face being drawn on one side. A is for arms. If you have a person who you suspect of having a stroke, stretch their arms up and one arm goes down, that is for arms. S is for speech. Whether the speech suddenly became slurred or incomprehensible, or if you feel that the person has just started speaking gibberish or garbled when they were absolutely talking normally a few seconds, few minutes, or even few hours ago, then T is for time to call 911. That's the mnemonic that you all should be aware of at all given times, whether you're in a supermarket, whether you're home, whether you're visiting someone, whether you're stopped at a rest stop. You should always keep that in mind.
So with that be fast, do they have to exhibit all of these things, or if they exhibit any of these things?
Either one of them could be a sign of a stroke, or a combination, or all of them. Some people might just have one or two or three or all of them. So any of those should raise a red flag. Any one of those symptoms present should make you suspicious for a stroke.
Okay, and so this is one of those things where you don't want to wait. I know that a lot of people want to put their loved one in the car and drive them to the hospital because they want something to happen very quickly. Why shouldn't you drive someone to the hospital who you think is having a stroke?
That is a very good question. So every single patient who's having a stroke, we know based on our studies from these patients that every second that a person is experiencing a stroke, that the brain is not getting the blood supply it needs, it loses 30,000 brain cells. Over the whole duration of one stroke, a patient's brain can age multiple decades. A 60-year-old person having a full-blown large stroke can come out with it with a brain that looks like an 80-year-old person. So they've lost 20 years worth of functioning. And that's why it's very important that you call 911. The EM professionals, the emergency medical professionals of every county are well trained in picking up the symptoms and then making a decision as to where they should be transporting you, because time is brain. Every second matters. And they know the shortest routes, the quickest ways to get you to the center where you can get the treatment fast. Once again, remember, time is brain. You might think that you're doing a loved one a favor by putting them in the car and driving them, but the time that it takes for you to load them in the car, drive through a traffic jam, come to an emergency department, get registered, and the time that someone takes to see them and finally identifies that they're having a stroke, you've probably lost 10, 20, 30, 40 minutes. That's crucial brain activity, and that's crucial brain power that's being lost at that time.
Okay, so call 911. Do not, there's no mistaking about that because time is of the essence. All right, what final messages do we have about stroke that you want us to all know?
So I want everybody to remember the mnemonic, be fast. Balance, eyes, face, arm, speech. Any of them is wrong, T, time to call 911. I want all of you to make sure that you're seeing your physicians regularly. Everybody, even those patients or those people who think that they're very healthy and maintain a healthy lifestyle, you should be getting your annual physicals. If there are any things that need follow-up, please do follow up with your physicians. A lot of us, including us medical professionals, are guilty of putting off our appointments and not seeing our primary care doctors. Please do not do that. Please go see your primary care doctors. Please see your specialists, cardiologists, and other specialists as given recommendations for. If you smoke, please quit smoking. That's one of the biggest modifiable risk factors that can reduce your chances of having a stroke. If you have high cholesterol, discuss with your doctors about getting that to a goal normal level that will reduce your chances of strokes. If you have atrial fibrillation, make sure you are in touch with your primary care and your cardiologist to determine what are the best options, surgical and medical, to prevent strokes. I know I crammed up too much in this, but remember all of these are very, very helpful things.
Yeah, and the main thing is go see that doctor. Get that started, get that going so that you can get a treatment plan going if this is pertaining to you. Thank you so much for your time. We so appreciate you. All of this is going to be in the To Your Wellbeing section of your website. It may be something you need to watch again or something that you show to a loved one.